Welcome to our comprehensive guide on eczema. Eczema is a chronic skin condition that affects millions of people worldwide. It's characterized by dry, itchy, and inflamed skin and can cause a lot of discomfort and embarrassment. In this video, we'll be discussing what eczema is, why it happens, and how you can treat it using both conventional and home remedies. Part 1. What is eczema? Eczema is a term used to describe a group of skin conditions that cause inflammation and irritation. The most common type of eczema is atopic dermatitis, which affects around 10 to 20% of children and 1 to 3% of adults. Eczema can occur anywhere on the body, but it's most commonly found on the face, neck, elbows, knees, and ankles. Part 2. Causes of eczema. Eczema is a complex skin condition with a multifactorial etiology. Although the exact cause of eczema is not fully understood, research has identified several risk factors that contribute to the development and exacerbation of the disease. 2.1 Genetics. A family history of eczema is one of the strongest predictors of developing the condition. Studies have identified specific genetic mutations that disrupt the skin's barrier function, leaving it more susceptible to irritants and allergens. 2.2 Immune dysfunction. Eczema is also linked to immune dysfunction, specifically an imbalance between T helper TE cells 1 and 2. The 2 cells promote inflammation and allergic responses, while the 1 cells suppress inflammation and promote immune defense against pathogens. In eczema patients, there is an overproduction of the 2 cells and a deficiency of the 1 cells, resulting in chronic inflammation and increased susceptibility to infections. 2.3 Environmental triggers. Various environmental factors can trigger or worsen eczema symptoms. These include irritants. Harsh soaps, detergents, and cleaning products can strip the skin of its natural oils and disrupt the skin barrier. Allergens, pollen, dust mites, pet dander, and certain foods can trigger an allergic response in susceptible individuals. Climate. Hot, dry weather can dehydrate the skin, while cold, dry weather can exacerbate dryness and itching. Stress. Psychological stress can activate the immune system and trigger eczema flare-ups. Microbes. Certain bacteria, viruses, and fungi can colonize the skin and trigger inflammation. Part 3. Diagnosis and treatment of eczema. Eczema is a clinical diagnosis based on the characteristic signs and symptoms of the disease. A dermatologist or allergist may perform skin tests to identify potential allergens or irritants that trigger eczema flare-ups. 3.1 Conventional treatments. The primary goal of eczema treatment is to relieve symptoms and prevent flare-ups. Conventional treatments include topical corticosteroids. These anti-inflammatory creams and ointments can reduce itching and inflammation in mild to moderate eczema. They come in varying strengths and are typically used for short-term management. Topical calcineurin inhibitors. These creams and ointments suppress the immune system and can be used for long-term management of eczema. They are particularly useful in areas of thin skin, such as the face and neck. Systemic medications. Oral or injectable medications, such as corticosteroids or immunomodulators, may be prescribed for severe eczema that does not respond to topical treatments. Light therapy, also known as phototherapy, this treatment involves exposing the skin to ultraviolet light to reduce inflammation and itching. 3.2 Home remedies. In addition to conventional treatments, some people find relief from eczema symptoms using natural remedies. Here are some home remedies that may be helpful. Coconut oil. Applying virgin coconut oil to the affected skin can help to moisturize and soothe itching. Oatmeal baths. Adding colloidal oatmeal to a warm bath can relieve itching and inflammation. Aloe vera. Applying aloe vera gel to the affected skin can reduce inflammation and promote healing. Probiotics. Some studies suggest that taking probiotic supplements or eating probiotic-rich foods can improve gut health and reduce eczema symptoms. Part 4. Lifestyle modifications for eczema management. Eczema is a chronic condition that requires ongoing management. In addition to medical treatments, making lifestyle modifications can help to reduce the frequency and severity of eczema flare-ups. 4.1. Avoid triggers. Identifying and avoiding triggers is one of the most important lifestyle modifications for eczema management. Common triggers include harsh soaps and detergents. Switch to gentle, fragrance-free products that are less likely to irritate the skin. Allergens. Identify and avoid allergens that trigger eczema flare-ups. Common allergens include dust mites, pet dander, and certain foods. Stress. Practice stress management techniques, such as meditation or deep breathing exercises, to reduce stress and prevent flare-ups. Climate. Avoid extreme temperatures and humidity levels that can exacerbate eczema symptoms. Sweating. Try to stay cool and dry to prevent sweating, which can irritate the skin. 4.2. Moisturize regularly. Keeping the skin moisturized is essential for eczema management. Use a fragrance-free, hypoallergenic moisturizer at least twice a day to keep the skin hydrated and prevent dryness and itching. 4.3. Wear soft, breathable clothing. Choose clothing made from soft, breathable fabrics like cotton, and avoid wool and synthetic fabrics that can irritate the skin. Also, avoid tight-fitting clothing that can rub against the skin and cause irritation. 4.4. Bathe properly. Proper bathing habits can help to prevent eczema flare-ups. Use lukewarm water and mild, fragrance-free cleansers. Avoid scrubbing the skin vigorously, which can irritate the skin. After bathing, pat the skin dry with a soft towel and apply moisturizer immediately. 4.5. Manage stress. Stress can trigger eczema flare-ups, so finding ways to manage stress is crucial for eczema management. In addition to stress management techniques like meditation or deep breathing exercises, try to engage in relaxing activities like yoga or Tai Chi. Part 5. Lifestyle changes for eczema. In addition to medical and home remedies, there are also lifestyle changes that can help to manage eczema symptoms. Here are some of them. Avoid triggers. Identify and avoid triggers that cause eczema flare-ups, such as harsh soaps, allergens, and stress. Wear soft clothing. Choose clothing made from soft, breathable fabrics like cotton, and avoid wool and synthetic fabrics that can irritate the skin. Keep cool. Avoid overheating and sweating, as this can aggravate eczema. Wear light clothing and use a fan or air conditioning to stay cool. Manage stress. Stress can trigger eczema flare-ups, so it's important to find ways to manage stress, such as meditation, yoga, or deep breathing exercises. Part 6. Conclusion. Eczema can be a challenging condition to manage, but with the right treatment and lifestyle changes, it's possible to reduce symptoms and improve quality of life. Remember to always consult with your healthcare provider before trying any new treatments or remedies. We hope that this guide has been helpful in understanding eczema and how to manage it. If you have any questions or comments, please leave them down below. Thank you for watching.